Hello and welcome to What the Health, a podcast exploring compassion and self-care in healthcare. I'm Dr. Funke Akiboye, a consultant physician interested in health and well-being. I feel that many of us in healthcare have lost the way to being well ourselves. In episode 1, I shared an experience of ill health that I had myself. Thank you to those who sent supportive, direct messages or reached out to check on me. By sharing some of my experiences, I hope to generate discussion around this topic. In this second episode, Avengers Assemble, I discuss some of the strengths or superpowers uncovered in my new team. I hope you enjoy. Avengers Assemble. In response to the COVID-19 pandemic, the hospital I work in has pulled staff from specialist medicine into general medicine. Many of these brave souls have not worked as general physicians for years, decades even, and have hit the ground running. It certainly put my anxiety of meeting a new team into perspective. I was pleasantly surprised to be assimilated into a fantastic team. The leadership was clearly from a consultant with a love of comics and creative streak, with the group aptly named Avengers Assemble. Although he was not working on the days I joined the team, his influence on both junior and consultant colleagues alike was clear and refreshing. He sounds the sort of creative leader I aspire to be. I let the junior doctors know that I'm on a health offensive and hope we can support each other within the team, and opened up the discussion for suggestions on how this could look for us. Two of them independently informed me that our comic aficionado had a similar ethos and had given them wrapped aloe vera plants when they joined his team. This is an ideal gift in so many ways. In addition to the many health benefits aloe vera is purported to have, from use on sunburn with its anti-inflammatory properties to aiding digestion and reducing acid reflux, it's also extremely hardy and difficult even for a busy junior doctor to kill. I have much to learn, but will certainly consider adopting the gift on entry into my toolbox. The current challenge is getting to know a team, the strengths and weaknesses of each member, and how we best work together as things become more difficult. Luckily, our comic Chief King consultant was a step ahead on this too, having invited the juniors to think about which superhero they would be, or what their superpowers or strengths are. Unfortunately, studying and working in medicine can be so all-consuming that people forget their superpowers and risk losing them altogether. I have musical superpowers, which I've managed to maintain up until now, and a couple of others that I deploy when things get really tough. The powers in our team range from multilinguicity to musicality and cryptic crosswords to competitive cruising, and that's just among the junior team. The first day with the team, we were discussing the joy of music and the parental expectations that some of us were driven by, which could be a whole episode or series on its own. I believe I became unwell recently after a period away from my usual musical outlets. So particularly under COVID lockdown conditions, restricted from my usual performance and social activities, I've been looking for healthy opportunities to let music out of me. I cautiously floated the idea of making a collaborative song, and this was taken up enthusiastically by some of the juniors. This enthusiasm embracing new opportunities is a superpower in itself. The musician, entrepreneur and writer Derick Manthiri has a short TED Talk called How to Start a Movement. It shows the importance of the first follower, the person that turns a lone nut into a leader. Subsequent followers then follow the follower. We have a particularly fantastic first follower in the group who responds enthusiastically to ideas and suggestions of how to take them further and responds in the group chat to light-hearted and meaningless gifts and videos with agreement on the topic. Not everyone in the group should lead. There must be followers, and their value in creating the leader cannot be understated. Superman said, "I think a hero is an ordinary individual who finds strength to persevere in spite of overwhelming obstacles." In healthcare, we try our best for our patients, but we're not superhuman, and we need to remember that. I've learned that knowing your own strengths and weaknesses and when and how to call on your team is important in life and healthcare and crucial for well-being. It isn't easy and it takes vulnerability. Thanks to our first follower, I was able to share an isolation song that I wrote while I was unwell. It was well received, and I feel bringing more of myself to the group through my musical superpower has helped others feel more able to communicate openly with me. So I'm more with Miss Marvel, who said, "When you decide not to be afraid, you can find friends in super unexpected places." Thank you for listening to What the Health. I would love to hear from you and find out what your superpower is and how you deploy it at work. Perhaps you're that person who can start a movement by being the first follower. Is there something I touched on that you would like me to go further into? Please share your thoughts in the comment box below. If you liked the episode, please share it with someone else you think may benefit from hearing this. Until next time, take care of yourself.